This topic is about acne, and as clinicians, we see a lot of acne, of course, but more importantly, they present differently, and we need to be able to differentiate between the different types of skin conditions. For example, if we see patients with acne on the forehead, now it's imperative that we check the hair as well to make sure that it is not seborrheic dermatitis associated with it if they just solely present with the pimples on the forehead. So the treatment is different. And sometimes they do present with lesions or pimples around the nasal area and a little bit and down in the chin area. That may in fact be seborrheic dermatitis and not acne. Typically the acne occurs on the cheeks, but sometimes we also get patients who present pimples or acne-like lesions around the chin area or the perioral area. So that in fact is perioral dermatitis and not acne itself. So it is imperative for the clinician to understand the different pathology that's going on. When it comes to treatment of acne, we aim at 3 steps. The first one is of course control of the acne, so there's no less breakout. Then the second step, which is a relatively easier step than control, because control has too many factors involved. It may be the diet, maybe the way of life, and the genetics. The blemishes are just discoloration. Most patients come in and they say, "Look, doc, I've got scars." When we look at them, they are actually not scars; they're just blemishes. And this with creams alone, and sometimes we require laser, is quite a relatively easy step. But we can't really treat the blemishes until we slow down or control the acne. Otherwise, every single breakout will cause blemishes to occur. Scarring is a big topic. Depends on the scars. There are different types of scars, require different type of treatment. However, if the patient presents first time with the scars, already scarred, then we become a lot more aggressive in the control of acne, because we really want to stop this or slow this process down to prevent treatment of scars later on. Scar is a very, very expensive process to, it's very time consuming as well to treat the scars.